Dr. Charles Chabert here, urologist and director of the Prostate Clinic. The following video is here to provide you with some information about Rezum, or water vapor therapy. For those of you that haven't heard about it previously, Rezum is a treatment choice for men who have urinary issues related to an enlarged prostate. Now, if I show you a little video by way of introduction, what you can see on the left-hand side of the screen is a video that's taken internally looking at the cystoscopic findings of a man with an enlarged prostate. And so what we're looking at here is a video inside someone's prostate. There's enlargement from both sides, and this gentleman has a very large median lobe, which is the projection of part of the prostate that grows up into the prostate and can act as a bit of a ball valve, causing obstruction when men try to void. Now, what you saw there was pre-treatment, and then on the right-hand side of the screen you can see a 6-month checkup cystoscopy or camera test that shows almost complete resolution of that very large obstructing median lobe. That is someone who has had treatment with Rezum. So how does it work? Well, this slide shows you, on one side shows you the endoscopic or the cystoscopic features, and we've got an animation on the other side, and what it represents really is that the cystoscope sheath is inserted inside the prostate and the delivery system is edged right up against the side of the prostate, and you'll see in just a moment a needle is placed into the adenomatous or the overgrown part of prostate tissue, and steam is delivered. It's about 1 cubic centimeter of steam is delivered per injection into the transition zone or the periurethral zone. That's that part of the prostate that's around the urethra that overgrows with time and causes an obstruction. Again, we're about to see the second needle placement to allow delivery of another cubic centimeter of steam into part of the BPH or the enlarged benign prostate tissue. And on the animation you can see slight overlap of the two zones, but delivery again of another cubic centimeter of steam. Now, the delivery of 1 cubic centimeter of steam, it takes 9 seconds to deliver, and certainly in my practice on average I use around 5 injections. It varies obviously depending on the size of the prostate that is treated, but what we're highlighting basically is that sequentially different zones of the transition zone, different zones are treated with a 9-second treatment and installation of steam into that particular area. At the end of the procedure, there is some swelling of the prostate because of the injection of that steam, and so men are treated with the placement of a urethral catheter to allow their bladder to drain and empty afterwards, and the majority of men can be discharged home on the same day with that catheter in place. And once we feel that that swelling has settled down, the catheter is taken out and a trial of void, as it's called, is then performed. So in this gentleman, there is no median lobe, 2 treatments on either side, and then a catheter is inserted. Okay, so let's have a little bit of a look at some of the science with regards how Rezum, or this convective wave technology, how does it actually work? Well, in essence, radio frequency is used or applied to water. That water temperature, or the thermal energy of water, is then increased. And so water is basically heated from room temperature up to 100 degrees Celsius, and that obviously generates steam. When we generate steam, in essence what we have is thermal energy that is captured in that transformative process. So we've got energy inside that steam, and that steam is then injected into the tissues. Now, it's convection rather than conduction, and I'll highlight the subtle differences between the two in just a moment. But with convection, what we have is a more uniform dissipation of that energy throughout the area or the zone, the treatment zone, that steam is delivered. Now, around 30 or 40 years ago, there was the original description of the zonal anatomy inside the prostate. We've got different zones. There's the anterior fibromuscular zone. There's the transition zone, which is the central part, or the part that's prone to BPH or enlargement. The central zone, which can result in the formation of a median lobe. And we've got the peripheral zone of the prostate, which is where the majority of prostate cancers arise from. So this slide highlights the subtle difference. As I alluded to beforehand, with convection, the energy in the steam dissipates through the interstitium, which is the spaces between cells, and as a result of that, it's evenly distributed throughout that space. So we have a fairly uniform distribution of energy within the zone, within the transition zone, where the steam is injected. Now that's in stark contrast to conductive RF thermal energy. What I mean by that is, with conductive energy, we have a heat source where energy is inserted to a particular zone, and the energy or the heat is transferred from cell to cell to cell. Now, the net result of that is that those cells that are actually closer to the heat source will be exposed to more heat, and those that are further away will be exposed to less heat. So we can actually get overheating of those areas closest to the source and underheating or undertreatment of those or that tissue that's further away. How does Rezum work? Well, as I indicated, we inject a small amount of steam that captures a lot of thermal energy. It's a small volume. It's less than 0.5 ml of water vapor that's actually injected into that predefined space, and that space, as I indicated, is in the transition zone. So we inject steam that has a temperature over 100 degrees Celsius, and it diffuses through the interstitium within the transition zone. It then condenses and it releases its energy, and this sudden release of energy causes denaturing of cell membranes, which ultimately results in tissue coagulation, necrosis, and cell death. There's also denervation of adrenergic nerves, and there's quite a lot of these adrenergic nerves in and around the bladder neck and in the prostatic urethra. And it's this denervation of these nerves that results in the very first improvement that men perceive as an increase in their flow rate or an increase in the pressure that they generate when they pee. Now, for most men, this experience happens around about 3 weeks following treatment. If we look briefly now at the zonal anatomy, and I highlighted previously that there are different zones or different areas that have previously been classified inside the prostate. We've got the transition zone, which is that periurethral zone. That zone is the area within the prostate that is really prone to enlargement. It is thought that it is the cumulative exposure to the male hormone, to testosterone, that generates cellular proliferation, and that's why we have a hyperplastic process. So it's BPH, which is benign prostatic hyperplasia, that results in the transition zone having a larger volume and therefore causing obstruction. The central zone, as I alluded to previously, can also undergo this hyperplastic process and result in the development of a median lobe, and it's a median lobe that can add to an element of bladder outlet obstruction by growing up into the bladder and therefore causing obstruction. The peripheral zone, far less likely to be influenced or to develop BPH, but is the main area where we see the majority of prostate cancers arise from. Now this slide is quite cool in my opinion. So on the right hand side, what we're seeing is the cystoscopic image whereby we deliver the Rezum treatment, but on the left hand side, this gentleman has a synchronous transrectal ultrasound that's being performed. And so what we're looking at there, that dark area in the middle, that hypoechoic area in the middle, really is the transition zone. And we've just seen the needle tip into the transition zone and the start now of a 9-second treatment whereby we're delivering that 0.4 of a mil of steam into that area. And you can see as it becomes more hyperechoic, so as it becomes brighter in its signal, it's consistent with the delivery of thermal energy to that zone. Okay, Let's have a look now at how that appears on an MRI scan. And so if we look on the left-hand side of the screen, you can see, so this is a coronal image of a bladder. The prostate is underneath. We've got the hip bones or the femoral heads on either side. And what we can see, these dark areas centrally placed there, they are the previously treated transition zones that we're seeing on both sides. Now that's, as I said, a week after treatment. If we move now to 3 months after treatment, we can see that those areas have almost completely regressed, and we're seeing only tiny areas of transition zone still being present. And that correlates with what we see clinically, that on average, it's about a 30% reduction in the size of the prostate that we can expect to see in someone who has had Rezum treatment. All right, let's have a look at some of the data. Now that we've got the scientific background, let's have a look. So this comes from a pivotal study. The IPSS, as some of you may be aware of, is our objective symptom score. And this is how we, in essence, grade individuals' severity of their urinary symptoms. Now, what we can see is if we look at everyone in this cohort that was treated with Rezum, so if we look over here, what we're seeing is that there is, on average, a 12-point improvement, in the IPSS score following treatment. If we look at those individuals that had more severe symptoms, so this column here is basically looking at those individuals that started their journey with a score greater than 19, which puts them into a severe category, they appear to get greater benefit than did when we looked at all of those men across the cohort. Now, if we compare to more standardized treatment, so if we have a look at TURP, we can see that TURP, or a transurethral resection of prostate, results in about a 15% improvement in that score. And if we look at various forms of laser BPH treatment, it has a similar IPSS improvement than when we compare it to those individuals who were treated with Rezum and had a score that was greater than 19 to begin with. Now, as standard, the majority of men that have urinary issues related to BPH, they start their journey with an alpha blocker, and on average we can see about a 4 to 5 point improvement on the IPSS score if men have an alpha blocker. Let's have a little bit of a look at some more data there. So if we look now at the data that is out to about 3 years, and one of the, if you like, one of the challenges that we have, and certainly one of the challenges that I see in my practice, is people want to know the likelihood of retreatment, or put another way, how long a specific treatment is going to last them for. And I say to them that with Rezum, we are limited with the data that we have because it hasn't been around for a long period of time. But what I do report to them is the data that we do have. And so if we look at, again, over here on the left-hand side, the IPSS score, the change from baseline, what we can see is that when we get out to about 3 months from the time of treatment, it's about a 50% reduction in their IPSS score, 50% improvement from where we started. So in this pivotal trial, we saw a starting point of 20 and at 3 months down to 10.6. And if we look out to 3 years, we can see that that improvement in the symptom score is durable. The Qmax refers to flow rate, and the higher the Qmax, the stronger the flow. So as you would expect, we started off with a baseline flow rate just less than 10, and the peak flow rate we saw was at 3 months following surgery, when that had improved to 16.4. A slight decline in the maximum flow rate moving out to 3 years, but overall about a 3.3 mil improvement in their flow at that time frame. Quality of life. So quality of life questionnaire is part of the IPSS, and it really looks at qualitatively the impact that an individual's urinary symptoms has on their overall well-being. And so what we want to see is that the quality of life score improves and remains improved, i.e. is durable for the duration of the study. And again, what we see is a similar graph in that there's approximately a 50% decline in quality of life from 4.4 to 2.3 at 3 months, and again is durable. maybe slightly better, out to 3 years. What about sexual function? And really, sexual function is the primary drive that I see in individuals that select to have Rezum in my practice. So this questionnaire, IIEF, is the International Index of Erectile Function. And in essence, the higher the score, the better the erectile function. So we want that score to be maintained following any kind of intervention, and ideally to be maintained for as long as possible. And that really is what is highlighted. The other thing to bear in mind with any of these longitudinal studies is that as men progress through life, through the natural aging process, that sexual function does begin to decline as men progress through life anyway. If we have a look now at whether or not we treat a median lobe, what we can see is that if we treat an individual's median lobe, we get a bigger improvement in their IPSS score, and we also get a bigger improvement in their flow rate. And that is to be expected. Basically, if we do treat a median lobe, we're removing more of the obstruction. Again, looking at some of the other studies, looking at some of the other studies and looking at the durability, this really highlights what we've seen in the other slides, in that we have about a 50% improvement in IPSS that is durable out to 3 years. So what about recurrence of urinary symptoms? Well, this slide, if we look over here at the left-hand side, we can see that there is some recurrence of urinary symptoms with Rezum, but it's at the lower end of the spectrum. Tuna, which is not really performed in Australia and certainly not done in my practice, is, as you can see, associated with a significant retreatment rate, whether that be medication or treatment with a different type of BPH treatment, or whether or not the primary treatment itself is repeated. Again, with TUMT, and also if we look at UroLift, for all of these there is an element of retreatment, but it certainly appears to be the greatest with either tuna or TUMT. Okay, the following study really looks at a comparison of the outcomes from Rezum and comparing those to the outcomes from combination therapy with an alpha blocker and also with a 5-alpha reductase inhibitor. The data from the medical arm of this comparative study stems from the MTOPS trial, which is a historical study that looked at combination therapy. For the very first time, looked at combination therapy to manage men with BPH. Combination therapy is the use of an alpha blocker and a 5-alpha reductase inhibitor. And what they found was that for men with slightly larger prostates, larger PSAs, and more significant post-forward residuals, those individuals did better longer term if they had 2 drugs rather than 1. And so in this study, what the authors did, and I'll just move myself across to the other side, but what the authors in this study did was to compare those individuals on combination therapy, previously published data, and compare it to the outcome using Rezum. And if you look at these 2 graphs over here on the right hand side, what you can see out to 36 months, so we've got 3 years of follow-up data, you can see that improvement in the IPSS, so an improvement in the self-reported questionnaire. When we're looking at urinary dysfunction, there's no real difference out to 3 years. And when we look at the Qmax or the flow rate, we can see that there's a favorable advantage for Rezum, meaning that at 3 months, Rezum gets men to a stronger flow than if they had combination therapy with tablets. But by the time we're out to 36 months, there's no real significant difference between the two. And so my take on that really is that men have the option, for selected cases, men have the option of either being on combination therapy or alternatively being on Rezum, and the likelihood is that they're going to have a similar outcome at 3 years. And it will really come down to the individual as to whether or not they would rather have a tablet with the potential side effects from a tablet, or whether they would like to have treatment with the potential adverse effects from a treatment. So what are the adverse effects from a particular treatment? Well, what we can see if we look at the outcomes from Rezum is that the majority, almost 60% of men who underwent Rezum didn't report any adverse outcomes or any side effects. Those that did, the majority of them were pretty mild and resolved within the first 3 or 4 weeks. But as you can see from this graph, the majority of those symptoms tend to be irritative in nature. Dysuria, so they had stinging and burning, they may have noticed blood within their urine, they may have had blood within their ejaculate, and there can be an increase in frequency, some retention and urgency, but those constellation of symptoms are in the minority. So to summarize with where we're at, Rezum is an ideal treatment for those men who wish to have treatment and wish not to be on medical therapy as a means of managing their urinary symptoms related to BPH, and ideally is a treatment choice for men who wish to preserve ejaculatory function as well as erectile function. Some of the trade-offs are that following Rezum, men do need to have a catheter in place for a few days. There is no sudden improvement following Rezum. Moreover, it's a gradual improvement, and the first sign of improvement really kicks in from about 3 weeks and continues to improve until about the 3-month mark. It's pretty well tolerated by the majority of men. There are very few side effects, and those side effects that are present tend to be mild in nature. This treatment is not for everyone. I certainly don't offer it to men if they're in urinary retention. I don't offer it to men if they have chronic retention, which is to say that they have very high residual volumes. They only incompletely empty their bladder and retain a significant volume. If men have a very big prostate, I don't think we have the data to confirm that Rezum is an ideal treatment for men with really big prostates. And by that, I mean, certainly in my practice, that if men have a prostate volume over around 80 cc's, I try and encourage them to select another treatment. Ultimately, it'll come down to discussions between you and your urologist, but I hope this helps. If you've got any questions, please leave them below. Please subscribe to our channel and have a look at some of our other videos and let me know what you think. Thanks again.